Women and children being the most vulnerable to malaria, an organization dubbed Rotary Malaria Committee, the Gambia, and partners have joined the crusade to fight against malaria. At the Bundung Maternal and Child Health Hospital, series of dramas were performed by the Jama Aksalam drama group meant to sensitize pregnant women and parents of children under 5 on how to prevent malaria. The key issues highlighted include carelessness, women failing to start nursing on time, environmental sanitation, and the failure to use insecticide-treated bed nets. The chairperson, Rotary District 9101 Subcommittee on Malaria, Dr. Emma Bruce, said the campaign started in 2019 but was suspended due to COVID-19 outbreak.
Pregnant women and children under 5 years old, they're the most vulnerable group in terms of malaria. So that's why we feel it necessary to complement government's efforts, bring the sensitization campaign to the different hospitals in the Greater Banjul area. We were in Kanifing Hospital a couple of weeks ago, and now we're in Bundung Hospital here. And we feel it necessary and timely for this malaria sensitization campaign, since the bed net distribution campaign is going to start very soon.
The program officer, Vector Control National Malaria Control Program under the Ministry of Health, Samuel S. Gomez, said the ministry has been working on eliminating malaria in the country. The current infection rate in the Gambia stands at 0.01%.
Our target is to reach zero malaria, and it should start with everybody. The Ministry of Health with the National Malaria Control are doing all their efforts to make sure that all the interventions to fight the vector, that is the mosquito that causes the plasmodium, is eradicated within the sub-region.
Officials of the Bundung Maternal and Child Health Hospital, including nursing officer Ami Jonga and public health officer Modi Job, both stressed the need for attitudinal change for both pregnant women and parents and called for the taking of intermittent preventive treatments, IPTs, whilst encouraging commitment from the caregivers.
One challenge I would talk about first is the intake of the IPT, that is the intermittent preventive treatment we give them when they come for clinic. That treatment is started at 4 months of gestation, that is 16 weeks. That is the time they start taking the IPT. But the challenges we encounter are, number one, these women most of the time would not take the medication. You will give it to them, they will put it in their mouths, but they will not swallow the medication.
It is not easy when it comes to the caregivers because the queue is too much. Some of them tend to stay away and say, okay, let me cook before I come. Let them prioritize their child's health because it comes first. Health comes first. So that's the issues we have mostly with caregivers and the like, not coming sometimes. It's not regularly here, but if they don't come, it becomes a problem. Because if the child comes and the child should have the remaining vaccines, it becomes tedious for the child.
The Rotarians Against Malaria under the team Zero Malaria Starts With Me are looking forward to achieving 0% of malaria in the Gambia. Majan Barrow, 4GRTS News.